Okay, so let's take a look at case number 8. A 49-year-old woman who recently immigrated to the United States from Nicaragua presents to the clinic with difficulty swallowing, constipation, and abdominal pain. She says her last bowel movement was more than a week ago. Physical examination reveals tachycardia and distended abdomen. An electrocardiogram shows Mobitz type 1 heart block. What is the most likely diagnosis? Chagas disease or American trypanosomiasis caused by the protozoan Trypanosoma cruzi. What is the vector of the responsible protozoan? The vector is the redviid bug, also known as the kissing bug because the bite is painless. What is the classic sign associated with the acute form of this condition? The Romana sign is painless, unilateral periorbital edema and conjunctivitis that results from acute Chagas disease. This sign is specific but not sensitive for acute T. cruzi infection. Where in the world is this condition commonly found? Chagas disease is commonly found in the southern United States, Mexico, and Central and South America, i.e. only in the Western Hemisphere. What is the pathophysiology of this condition? The woman is experiencing chronic Chagas disease, which is most often characterized by heart block, ventricular tachycardia, and dilated cardiomyopathy. Dilation of the esophagus and colon, megaesophagus and megacolon, can cause difficulty swallowing and constipation. The acute phase of the disease can be characterized by a hard red area called a chagoma, and the parasite's site of entry into the host, accompanied by fever and meningoencephalitis. In endemic areas, the acute phase is seen more frequently in children. What is the appropriate treatment for this condition? Nifurtimox and benzinidazole are used to treat acute cases. However, there is no effective treatment for chronic Chagas disease. For chronic heart disease, supportive measures for congestive heart failure, antiarrhythmics to prevent recurrent ventricular tachycardia, and pacemaker implantation for heart block are used. For gastrointestinal disease, dilation of the esophageal sphincter, changes in diet, the use of laxatives and/or enemas, and in some cases eventual resection of the megacolon are used. What other disease is caused by the protozoan species that causes this condition? The protozoa Trypanosoma gambiense and Trypanosoma and rhodesiense cause African sleeping sickness. This illness is characterized by lymphadenopathy, recurrent fevers due to antigenic variation, somnolence, and possibly coma. It is transmitted by the tsetse fly, whose bite is painful.